All right. Hi, everyone, and welcome to today's recording about the Healthcare Innovation Advancement Framework. My name is Maura Little. I am the Executive Director of Cambia Grove. Cambia Grove is a healthcare innovation hub. What we focus on is breaking down barriers to innovation to create a more person-focused and economically sustainable healthcare system. A couple of months ago, we launched something called the Healthcare Innovation Advancement Framework. It's a brand new framework that puts in perspective how innovation can truly transform the healthcare system towards the triple aim, as well as how we need to optimize certain ecosystem elements. To dive into today's discussion about the Healthcare Innovation Advancement Framework and our work at Cambia Grove, I am being joined by Julie Anderson, who is our Director of Strategic Initiatives. Julie is going to dive into the advancement framework and level set and give some context. At the end of her presentation, I will be joining Julie to go into some of the frequently asked questions that we've heard from the community. And with that, Julie, take it away.
Thank you, Maura, and thank you to our viewers today for your interest in the Healthcare Innovation Advancement Framework. I'd like to first share a bit of my own background to help explain my passion for this topic, as well as the perspective that I bring before getting into the details of the presentation. I've been in healthcare for nearly 15 years. I've worked in the provider space doing process improvement, the public health space, analyzing resource utilization, the payer space, implementing collaborative care models, and I've now worked with Cambia Grove's inspiring community of change makers for more than 3 years. In each of these spaces, I have been continuously blown away by the truly incredible innovation that is out there. And as a leukemia survivor myself, I quite literally owe my life to healthcare innovation. We see groundbreaking work happening every day, both in our local communities and through our partnerships with incredible innovation hubs across the country. But we also know that we must fundamentally shift the way that we celebrate and measure healthcare innovation in order to achieve the greatest impact. Here's an example. Through Cambia Grove's partnerships with one of the innovation hubs I mentioned earlier, I recently had the opportunity to volunteer at a startup competition. I was disappointed to see solution after solution emphasize profitability over patient experience or population health. At least one of these solutions was chosen as a winner of the competition. In any other industry, it would make sense for these considerations to be prioritized and even rewarded. But this is healthcare. We aren't just dealing with individuals and families. We are dealing with issues of life and death. Before accepting my role with Cambia Grove, I was admittedly skeptical about the impact that certain kinds of innovation could have on the healthcare system. I had seen firsthand too many examples where the main driver was personal financial gain. And I've since seen this theme reinforced further by funders, accelerators, and even customers. From my former vantage points within payer and provider organizations, I could see where individuals were profiting off a broken system or creating solutions to problems that didn't exist. And at the same time, we all know that there are critical opportunities for improvement in our existing system. We spend the most on healthcare and have the poorest outcomes when compared to other similar countries. And we are unfortunately seeing funding for healthcare innovation increase without seeing the corresponding improvements in cost for outcomes. But it doesn't have to be that way. And that's why we developed the advancement framework. As you can see here on this visual, the advancement framework is broken up into 3 categories. First, you see the triple aim, which is essentially our North Star. It's how we defined the end goal of the innovation in healthcare that we want to see, which is to achieve improvements in cost, patient experience, and population health. Second, we outline the process of developing and implementing impactful innovation that will help us achieve the triple aim. And finally, we describe the ecosystem elements that must be optimized in order for this kind of innovation, impactful innovation, to succeed. Those 3 elements are infrastructure, incentives, and culture. I spoke earlier about innovations that I've seen that are focused primarily on profit. In order to shift our focus to support innovations that have the potential to truly impact the triple aim, we must optimize these 3 key elements: infrastructure, incentives, and culture. Let's dig into this a little bit further. I was brought on to the Cambia Grove team 3 years ago to create and launch the Solutions Lab, which is an initiative aimed at breaking down barriers to innovation in healthcare. The approach we took at this time was to pick a topic from our conversations with the community and then dig in to see how we could remove obstacles for innovators. When investigating these barriers and learning about the reasons that potentially impactful innovations fail, we heard a wide variety of explanations that ranged from, we don't have access to enough data, or nobody will pay for it, or the system is resistant to change. And as we dug into these seemingly infinite barriers, we realized that what we were hearing was simple, and it all came back to these 3 key elements: infrastructure, incentives, and culture. In other words, every barrier we uncovered fell into one of those 3 buckets. Infrastructure includes the resources needed to develop solutions, as well as the right physical and technical systems. Think data interoperability and broadband. Incentives are key to driving and influencing behavior. In healthcare, we mostly find these in the way that our healthcare system pays for care. Is it through a fee-for-service model, a value-based care arrangement, or something in between? And finally, culture. Culture focuses on trust, openness to change, and having the cultural competency to create solutions that match the problems that exist. Without these critical ecosystem elements, potentially impactful innovations will continue to sit on the sidelines due to the barriers that they face. Our theory with the Healthcare Innovation Advancement Framework is that by optimizing these 3 elements, by putting the right pieces in place, impactful innovation can more seamlessly lead to the triple aim. So what is Cambia Grove doing about it? Cambia Grove is leveraging this framework to guide us as we continue our approach to convene stakeholders, identify barriers, and catalyze solutions towards a more person-focused and economically sustainable system. We also know that we can't do it alone. In 2020, we partnered with leaders in Washington, Oregon, and Utah to apply the advancement framework, create state-specific ecosystem reports, and outline detailed calls to action. If you are working in one of these states, please take a look at these reports. And if you would like to complete a report to assess another state, we can help guide you in your efforts. However you choose to get involved, we invite you to join us in this important and exciting work. And with that, I would like to bring Maura back to the stage for a quick Q&A session. Hi, Maura. Welcome back.
Thank you, Julie. Thank you.
So I'd like to start by asking you a question. Just a moment ago, I invited our viewers to get involved in this work, and I would love to hear from you. What would you recommend? What are some good ways to join us?
Sure, there are plenty of ways to join us. I would say that the first way and the most direct way is to take a look at our website and take a look at the membership that we offer. Our membership is and this is not a sales promotional element at all, but our membership is full of more than 400 individuals who self-identify as innovators in the healthcare innovation ecosystem and are working day in and day out to try and create a better healthcare system. It's currently a free opportunity for anyone to join. We have people across the country. We even have people around the globe getting involved and really discussing how we can create these ecosystems and really pivot and make ecosystems more readily supportive of impactful innovations. Another thing is to reach out to yourself, reach out to me. Our names, it's Maura at cambiagrove.com. It's Julie at cambiagrove.com, and discuss the report. The framework itself takes a moment for you to kind of bend your way of thinking. It's a brand new framework. It's one in which it doesn't fit categorically into the economic development framework or frameworks that we've seen around healthcare specifically at large. And so reach out to us. We always love talking to individuals and looking to learn from each other and build off of this great work. Yeah.
Great.
Speaking of that, okay, my turn to ask you a question. So
Yes.
we worked for a while on this framework. It's been a work in progress over the last couple of years. And we are lucky enough to find a great partner in Point B to bring the framework to life and really invigorate it. Julie, as you look back over the development of the framework, what are some of your aha moments that really kept you working towards this final deliverable and continues to keep you engaged and excited about pushing this forward?
Yeah, absolutely. That's a great question. And I've had many. I'll try to pick just a few. So I think my first and perhaps my most clarifying aha moment was about the barriers to innovation all falling in to one of the three buckets: infrastructure, incentives, and culture. I've been asked in the past, I think it actually may have been by you, Maura, about what, from my perspective, was the biggest barrier to innovation in healthcare. And my answer at the time was the complexity. I still think that that's true, but an aha moment that I had was that by bucketing all of these incredibly complex and varied barriers into these three buckets, it provides a much more accessible way of thinking about it, where instead of it seeming impossible to make change, instead it really does allow you to focus in on these categories and then break it down from there. To that point, I think that another aha moment was as we applied the framework in the three states where we did our analysis. It was also really interesting to see that there was a lot of overlap in the opportunities for improvement. Certainly, each state is very different. Their needs are different. Their structure is different. The players are different, but there is a lot of overlap. And it's interesting to see that there are consistencies as well as those unique elements to any ecosystem.
Julie, absolutely. Those were definitely some aha moments as well. Taking a step back, and one of the questions that we hear in the community, and we hear, one of the things that we grappled with as we are forming it is this idea of impactful innovation versus innovation for innovation's sake. And we know that innovation can be a very long process. It typically is a very long process in healthcare, of course, and it's a very difficult process. Talk the audience through the thought process around why we focused in on impactful innovation and what that really means.
Yeah, good question. So we defined impactful innovation as, it's sort of in my mind has two different parts. The first part is, what does that mean? Impactful innovation means innovation that aims to positively impact the triple aim. So specifically has an end goal in mind that is improvement in those three areas of cost, experience, and care. And so what we wanted to do was first define that, what do we want innovation to achieve? Then the second part was unwrapping what steps would need to be followed in order to do that. And I think what's really critical about the impactful innovation process is starting with deep problem identification as the first phase to complete, rather than what we've seen at times in innovation in healthcare is jumping straight to solution. We really think that the most important part is deeply understanding and, to a certain extent, falling in love with the problem rather than jumping right to the solution. So we built out a process that enables that deep understanding of the problem, iterative testing and feedback and implementation and scaling that enables the solutions to really match what the problems actually are. From my experience, having worked on the provider or payer side, what I would sometimes see would be solutions that would come to us that were so close to being right for the problem. They were almost there, but it was obvious that deep problem understanding just hadn't been done, that step had not been completed. And if it had been, we would have been able to share some of those details that could have made the innovation that much more impactful. And in these examples, not only would that help us get to the triple aim, but it would also have helped the companies sell their products. We would have been more likely to purchase the product if it had more closely matched the problem. So that's why we outlined those steps and really made clear what kind of impact we wanted to see.
Yeah, absolutely. One question, just a little bit more nuanced, that I continue to get when I talk to people about the Healthcare Innovation Advancement Framework is its role in the economic development sphere. And
Yeah.
being able, I just want to take a moment to address the idea of impactful innovation versus innovation at large. Because innovation at large, we have seen tremendous growth in healthcare innovation, really throughout the states that we're working in Washington, Oregon, and Utah, and really across the country with a lot of our partners that we work with. There is a phrase of fail forward, and there is the necessity to fail forward and be able to take those risks. But to your point about really zeroing in and falling in love with the problem, that's where we see the difference between innovation for really the economic development angle versus innovation for improvement in the healthcare system. One other note is I used to work as an economic development. I worked in economic development for the state of Washington. And what we really focused on then was how do we increase employment and gross business income? And there are elements in the advancement framework that include some of these different metrics around economic development, but the goals are slightly different. It's the increase in employment versus the ability to meet the triple aim. So as you watch this and as you wrap your head around this, please reach out to us and ask questions about the advancement framework and how potentially the advancement framework can be applied either within the state that you live in, within your work, or how you can get involved. Julie, thank you so much for your time today and for walking us through the advancement framework. Is there anything else that we should note before we close out today's recording?
I think I would just echo the sentiment that we both made earlier about getting involved. I invite anyone watching today to not only check out the reports themselves on our website, but also to reach out and to look for future programming where we outline more information about the advancement framework at large, as well as all of the work that we're planning to do to dive into the ecosystem elements more directly. So please take a look at our calendar and join us for an upcoming event.
Fantastic. And with that, I think that's a wrap. Again, reach out to us if you have any questions. And thank you for your interest in watching this video. Thank you.
Thank you.